Next here at 5, if your workplace is anything like ours, you probably had a number of colleagues calling in for illness lately.
Respiratory virus season is just getting started, but locally, one virus has already taken the lead. Dr. Frank McGeorge is here with what it is. And Frank, I gather this comes from a number of sources, probably.
Yeah, it does. And the first source is what I'm seeing in the ER. Now, we're talking about RSV. So in the average healthy person, it's just going to feel like a bad cold, cough, congestion, fever, sore throat. And usually that's going to be something that you can manage at home, but would probably call off sick for. Now, the two other sources I looked at to confirm my impression is the Henry Ford Health Lab data, where there's actually also been a consistent increase in the percent positive tests over the past couple weeks. And finally, the state's data, which also shows RSV increasing in southeast Michigan. So that may help explain some of the illnesses that you've seen. Here's the larger national view, though.
Across the U.S., emergency department visits for diagnosed RSV are now moderate for the first time this season, with the main increase among young children. But respiratory virus season is just ramping up. So far nationally, preliminary CDC estimates find up to 1.5 million flu cases, with potentially 22,000 hospitalizations and up to 2,100 flu deaths between October 1st and November 30th. And these viruses, along with COVID-19, are expected to increase.
The present vaccination rate is similar to previous years, but it's still running below what it did prior to COVID.
As always, vaccination for flu, COVID, and RSV will be key to preventing severe illness. The CDC recommends everyone 6 months and older get the flu and updated COVID shots. The one-time RSV vaccine is recommended for adults 75 and older and those between the ages of 60 and 74 at high risk for severe disease. Pregnant women can also protect their unborn babies against RSV with a shot between 27 and 36 weeks of pregnancy. And infants up to 8 months old born during the season can receive 1 dose of monoclonal antibodies.
Right now, RSV is the leading cause of infant hospitalizations in the U.S.
Now, looking at it like a forecast, I would consider the current RSV increase wave number 1. But based on the local and state level data that I've seen, the flu and COVID have yet to take off, but they are clearly on the horizon. They're just in other parts of the country right now.
I see. So I would imagine people traveling for the holiday, that's going to probably speed up the spread.
Yeah, I think that's a pretty sure bet. The only thing that I would say is hopefully RSV is already going to have made enough of the rounds in our area that we're going to have better collective immunity if you haven't been vaccinated. But based on current levels nationally, looking at COVID and the flu, it's actually the flu that I think might make a bigger splash after the holidays. And I think that's something we need to watch out for.
The flu more than COVID.
Probably more than COVID, yes.
Such a lovely gift to pack around, right? Oh.
Well, and we may just get lucky and maybe the vaccine is going to cover the flu ideally, and we may not even have that big a flu season, but I wouldn't count on it.
That'd be A-okay.
Right.
Thanks, Doc.
Let's move to the season. Thanks, Doc.